to The Doctor is In, your daily guide to virtual care in this time of COVID-19. I'm Dr. Freddie Gomez, and we are looking forward to answering your questions in the next half hour. The number of COVID-19 cases is expected to increase based on the forecast made by the University of the Philippines Octa research team. The study predicts 40,000 cases by the end of June. And that's why finding additional ways to shield ourselves and our loved ones from the virus may be of importance. While a vaccine is still unavailable, there are new gadgets that claim to protect us from infections. Today, we'll discuss the validity and reliability of these gadgets, including the Philippine-made ventilator for COVID-19 response. So joining me right now is Dr. Lemuel Abrogena, who specializes family medicine and is an assistant professor at the Ateneo School of Medicine and Public Health. Welcome to the show, doctor.
Good afternoon, Doc Freddie. Good
Now,
afternoon.
Dr. Lemuel, there's a recent forecast by UP researchers which shows that COVID-19 cases will reach up to 40,000 by the end of this month. Should we expect this to happen given that cases are continuously rising? Should people be concerned?
Yes, Doc Freddie. So, the University of the Philippines COVID-19 response team recently published their data. Okay, so this is as of June 8th, 2020. Okay, so they have based that data from June 7 upward. Okay, so if you can see that data, okay, that has been provided to us. Okay, so there's about a lot of cases that have been detected. Okay, so but there was a difference between the actual number of cases, which are COVID-19 cases, okay, and the number of positive cases that were tested. Okay, so this particular difference is the lag, okay, that the Department of Health is trying now to resolve. Okay, so that at least we would be able to come up with the data that is somehow on the spot. Okay, so real time. Okay, so as of yesterday, there's already 25,930 cases. Okay, 539 of which are considered new cases. Okay, so the past few days, there's really now an increasing. Okay, it's consistent. It is increasing in terms of the number of cases. Okay, that have been tested and reported. Okay, to be positive. Okay, so but still we're still not able to account. Okay, for the population that were not tested and yet might have the virus.
Do you think that there are many factors kung bakit patuloy pa rin ang pagtaas ng mga cases natin, ano? But do you think that the GCQ status could have been too soon?
Well, if you think about it, okay, so the Department of Health as well as the IATF has given us some guidelines and recommendations on how to decide in terms of lifting the quarantine. So we started with an enhanced community quarantine. Okay, so with that ECQ, it has provided us with information, okay, on whether or not we need to proceed, okay, and become GCQ. Okay, right now we're under general community quarantine. Definitely, the basis for these decisions is science. So we started with the numbers. So that is an important point for us. Okay, now I really cannot uh, say whether or not we did the right decision of uh, starting the GCQ already, despite the fact that the numbers are continuously rising. We are going to wait for the recommendation that will be given later by the president. Okay, so let's see. The GCQ or the quarantine actually was started to really decrease the transmission of the virus. Okay, so this is some way to help our health system prepare. So I just received a memo a few minutes ago from the PGH, okay, clarifying now, okay, how much beds are still available in the State University Hospital, okay. So with that alone, okay, so we have to really consider, okay, that the number of cases should be prevented, okay? So that the increase should be halted so that the health system will be able to respond very well, okay, and cater to the needs of the COVID-19 positive cases.
So hopefully, the point of all this is hindi ma-overwhelm ang ating mga ospital sa pag-treat ng mga cases. Ano? So now let's
That
take a look at
that is
our
very
social
important.
media questions. We have one from Adrian who is asking, how should barangay officials enforce health precautions during GCQ? Marami na kasi ngayon ang nasa labas ng bahay at ang iba ay walang suot na face mask.
Okay. The Philippine Academy of Family Physicians released a statement guideline statements, okay, for community-oriented recommendations, okay, in response to the pandemic. Okay, so in that guideline, we recommended that there should be an active participation of healthcare provider, okay, uh, in coordination with the local government unit in terms of the implementations, in terms of the decisions and policies that has to be instilled in the community. Now, we are still under the general community quarantine. Okay, part of the recommendation is actually when you go out of the house of your houses, dapat may reason. Dapat talagang pupunta ka ba sa trabaho, bibili ka ba ng essential goods mo, etc. And when you go out, okay, you really need to wear the face mask. So that is an important provision. Now, our social media sender asked, paano ba ang gagawin ng barangay health officials? Okay, I think kailangan nila na patatagin yung mga policies that is being developed, okay? Or if ever man that they're following the policies and guidelines by the upper local government units, okay? So that should be properly implemented, okay? Now, it will actually boil down in terms of the behavior also of the individual. So each one of us has the responsibility to reduce now the transmission of the virus if we do not have anything to do outside of our houses, except if we're going to work or except if you're going to buy some essential, your essential goods, okay, we still recommend, even though that we are in general community quarantine, okay, to stay home because that's part of the recommendation still for your general community quarantine.
Yeah, so staying at home unless talagang may kailangan gawin is essential. So aside from the barangay officials, dapat nasa individual na tao pa rin ang tulong-tulong. Okay? So,
Yes.
still to come, we evaluate gadgets that are advertised to protect you against COVID-19. Stay tuned. The doctor is in on CNN Philippines. We'll be right back. Welcome to The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez, and we want to make the most out of your telemedicine appointment today. So please keep on sending in your questions, and we will answer them as soon as we can. So, one of the more popular measures people have taken against COVID 19 is using certain gadgets available freely online or on social media. And some of them is called a virus shutout and SDS blockers. But can these tech gadgets really protect us from COVID 19? With me is family medicine specialist Dr. Lemuel Abrogena. Now, Doctor, these popular gadgets that we see online, some of the two more popular ones, is called the SDS blocker and the virus shutout. Now, both of them claim certain things, but in general, ang claim nila is that they can protect us from COVID-19. So, my question is, can these gadgets significantly have an effect in protecting us from COVID-19?
So, Doc Freddy, the Food and Drug Administration has warned us against the use of this type of products, okay, noting their deceptive marketing and promotion of such disinfectants. Okay, so that might not help in preventing the spread of COVID-19. So it is our responsibility to be worried about the use of these gadgets, especially that there are no studies that has proven their effects.
Yes, a lot of these gadgets actually market on the hope that people have, no? Because as we all know, this COVID-19, maraming uncertainties with COVID-19. There's still a lot we do not know about it, and some, unfortunately, take advantage of people's fear of the unknown in trying to market these products. Now, are there any possible side effects that these products can give the person? Because a lot of people might think, well, if it doesn't harm me, why not give it a try?
Okay, these gadgets promise that they actually would purify the air that you inhale. However, exposure to such chemicals through inhalation and possibly skin contact may cause irritation in the mouth, esophagus, or the stomach. Okay, it can also cause shortness of breath and other respiratory problems. Okay, so this was quoted from the Food and Drug Administration. Okay, looking at these two devices that is currently available and being marketed. Okay, in all social media platforms. So there's still a side effect, and we have to be
Okay, so people
careful on the use of these gadgets and devices.
Yes, so people must be double, triple wary when it comes to these products. Now, another product that a lot of people see online that tout to be a COVID-19 protectant or protects us from COVID-19 are gadgets that use UV light. So aside from, social distancing, washing of hands, UV light din ang sinasabing or ina-advertise will be able to disinfect or protect us from COVID-19. What's your take on these gadgets that use UV light?
Okay. There are actually three devices available in the market, okay, that somehow has proven the effect in terms of decreasing the transmission of the virus. Okay, the air purifiers, okay, you must have heard them. Okay, yung the use of HEPA filters sa ating mga air conditioning unit. And ito nga po, yung UV light, okay, your ultraviolet germicidal irradiation devices. Okay, so we have to understand first, okay, ano ba yung UV radiation? Okay, so the UV radiation covers the wavelength range from 100 to 40 nanometer, which is a higher frequency and lower wavelength than the visible light UV. Okay, so remember that yung sun, okay, itong sunlight po natin, meron ding UV rays yan. However, okay, it is not high of frequency that would somehow give us some side effects. Okay, the UV radiation coming now from these devices, okay, would somehow with high level could kill viruses. Okay, so there is actually a study that had shown that a short exposure of the UV light, okay, it can actually first attack, okay, or decrease the transmission of a virus, of a bacteria, and of the spores. Okay, so pinakamatagal yung spores. Okay, so kasi meron silang protective layering. Okay, okay, now in terms of the UV light, what is recommended is the 240 nanometer UVC. Tatlo po kasi yung type ng UV radiation natin. UVA, UVC, UVB, and UVC. Okay, so the current recommendation, okay, would be the use of your UVC, with about 240 nanometers. Okay, so and it's also important when you use your UV-GI devices. Okay, kailangan nyo makita, okay, yung length of exposure ng area. What is recommended is that the longer it takes, okay, kunyari yung nakikita ninyo po ngayon sa screen ninyo in the LRT, diba may idinadaan po yung UV light, okay, doon sa loob ng area. What is recommended, okay, is at least, okay, 2 to 5 minutes of exposure. Now, there are studies that have shown na kahit 30 seconds, okay, it would greatly decrease, okay, the virus present in the air, okay, so about 50%. The longer, okay, mas bababa siya at least to less than 1% already, okay, so the studies have shown that 10 minutes exposure, bababa na siya to 10%, to less than 1%. But very important also, okay, hindi pwedeng gamitin yung UVC, okay, sa sarili nating skin. If you can see yung screens po ninyo, okay, naka PPE po yung gumagawa ng UVC to protect him. Kasi meron ding effect po yan sa skin natin. And it's not advisable, okay, because there are some means that has come out, okay, na ang gamitin na lang is yung UVC as a disinfectant. Okay, that is a big no-no because it would cause, okay, certainly some effect in our skin.
Okay, thank you very much, Dr. Limuel Abrogena, for joining us today on The Doctor is In. Your inputs
Thank you very
on
much.
whether these gadgets are valid or reliable will definitely help our viewers think about purchasing these in the future.
Thank you very much, Dr. Freddie.
And just ahead, we will discuss a locally made ventilator to help fight COVID-19. Stay tuned. The Doctor is In on CNN Philippines. We'll be right back. Welcome to The Doctor is In. I'm Dr. Freddie Gomez. Thank you very much for watching. And I'd like to say that a lot of Filipinos have helped in the fight against COVID-19. And this has led to some notable inventions. One of these is a proudly Filipino-made ventilator, a machine that is highly essential in the battle against COVID-19. We have with us Dr. Abundio Balgos, who is a pulmonologist and the creator of the low-cost ventilator called Ginhawa that is used to help those infected with COVID-19. Hello, doctor, and welcome to The Doctor is In.
Hello, good afternoon, everyone.
Dr. Abundio, can you hear me?
Yes, I can
Okay, we're
hear
trying to
you.
get the audio on Dr. Okay, can you hear me, doctor?
Yes, I can hear you. How's my audio now?
Okay, great, great, great. At least the viewers can hear you as well. First of all, doctor, congratulations on Ginhawa. Can you share with us your motivations in inventing the first locally made ventilator?
Actually, we have been working on a Filipino-made ventilator since 15 years ago. We had a couple of prototypes. We started out with very crude models in the late 1980s, and we were able to improve it until we have what you see here now was our prototype in 2018. Although our latest prototype, which is already ready for testing in the field, uh, is smaller than this, than what you see on the screen. The main motivation that we had was we wanted to allow patients who are not able to afford expensive ventilators, as well as the small hospitals, to be able to get an affordable ICU ventilator that is good for everyone.
That's great to know because, as you know, doctor, ventilators are definitely in demand, especially at this time. Now, even before your invention, ventilators were somewhat of a scarcity when it comes to certain hospitals. Now, let's go to some social media questions. I'm sure a lot of people have questions with regards to your ventilator. Our first question is from Joanne. Ang tanong niya ay, saan po ginagamit ang ventilator? Bakit ito kailangan ng COVID-19 patients?
Ang ventilator ay makina na tumutulong huminga sa mga taong nagkakaroon ng problema sa paghinga, no? Yung tinatawag naming respiratory failure. So, itong makinang ito ay ginagamit kahit na hindi COVID. So, kung nyari may sobrang matinding pneumonia o matindi ang heart failure or anumang iba pang problema na hindi na makahinga ng sarili ang pasyente, ginagamitan ng makina para habang ginagamot yung primary problem o yung talagang problema na nag-cause ng respiratory failure, matatide over yung pasyente.
Okay. And especially now that with COVID-19, the ventilator is very essential, especially yung mga pasyente na nagkaroon nakapunta na sa critical na symptoms, very vital po ang ventilator para sa paghinga ng lungs nila. We have another question from John. Ang tanong niya ay, ginagamit na po ba ang ventilators na ito sa mga ospital?
Hindi pa. Ang aming prototype, actually natapos na namin ito ng 2019. Pero sa kasalukuyan, nagbe-bench testing pa lang kami. Ang timetable namin is sa August, i-field test na namin ito sa 5 hospital. So, limitadong hospital pa lang muna yung paggagamitan ng ventilator na ito.
Okay, so I'm sure a lot of us, including myself, will be excited with the results that can be seen this coming August. And we have another question from Stephanie. Ang tanong niya is, how is a Philippine-made ventilator different from those that are sourced abroad?
Actually, very much similar siya. In fact, sa ngayon, itong modelo namin ginagawa, karamihan ng mga parte nito ay imported din kasi hindi pa wala pang kakayahan ang mga Philippine manufacturers na mag-produce ng mga parts na medical grade ng tawag. No? Pero ang objective namin ito is sa loob ng 1-2 taon, yung lahat ng parts ng ventilator na ito ay magiging Philippine-made na. Pero kahit pa man imported yung ibang parts na ito ngayon, ang presyo ay malaking pagkakaiba. No? Karamihan ng mga ICU ventilators ngayon ay lumalagpas ng 2 milyon. 2 milyong piso ang halaga. Pero itong local na ventilator na ito sa production namin na hindi pa nga mass produced, baka umaabot lang siguro ng mga 300,000 hanggang 400,000 ang magiging price nito.
Abundio Balgos, I salute you and all the Philippines in the service of the Filipino countrymen. So thank you again for joining us here on The Doctor Is In.
Maraming salamat at binabati ko ulit ang kayong lahat at saka yung lahat ng nakikinig sa inyo.
At salamat din sa lahat ng aming mga viewers. Sana ay nasagot namin ang inyong mga katanungan tungkol COVID-19. Samahan niyo po kami ulit bukas, 3:30 p.m. dito lamang sa CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.